cartilage is the smooth protective covering on the ends of bone. So when you lose that, you get arthritis, which is truly bone on bone, and talking about knee replacements. But certainly for our young, active folks with more isolated focal cartilage defects, there are options now, and I think we're fortunate to have a couple of things that we can do. One of them is to harvest cartilage from your own knee, grow that in the lab, and actually reimplant that back into the knee. We can also do something where we perfectly size match your knee to a cadaver graft of bone and cartilage and implant that into the knee. And sometimes we pair that with other surgeries to try to realign the knee as well. And our goal is to try to restore as much normal anatomy and function as we can going forward to try to keep you healthy and active.